Thank you very much for inviting me, and welcome everybody. Are you all okay? Are you 2:30 on Sunday afternoon? Are you not in the corner? You're all okay. Well, welcome to my talk. So I'd like to start by a poem. I've got a poem to read you. And this is all about creating ripples, because that's what I want you to do. Drop your little pebbles, or big pebbles, or even rocks, if you like, and create ripples. So, but the poem is called Drop a Pebble in the Water, and it's James W. Foley. Drop a pebble in the water, just a splash, and it has gone. But there's 100 ripples circling on and on and on, spreading from the centre, flowing on out to the sea, and there is no way of telling where the end is going to be. Drop a pebble in the water, in a minute you forgot, but there's little waves are flowing and there's ripples circling yet. And those little waves are flowing to a great big wave have grown. You've disturbed a mighty river just by dropping in a stone. Drop a word of cheer and kindness, just a flash and it has gone, but there's 100 ripples circling on and on and on, bearing hope and joy and comfort on each splashing, dashing wave, till you wouldn't believe the volume of the one kind word you gave. Drop a word of cheer and kindness, in a minute you forgot, but there's gladness still a swelling, and there's joy circling yet. And you've rolled a wave of comfort, whose sweet music can be heard over miles and miles of water, just by dropping one kind word. So I'm passionate about connecting to the NHS and the doctors and the local allied professionals in Norwich. And I want to share my passion with you and hopefully try and inspire some of you today to do the same thing. Drop your pebbles or your rocks, create some ripples, and you never know what might come back. What we do for acupuncture as a whole, and what you do for your own individual practices if you send those little waves right out. So welcome to my talk. Let's see what we're going to cover. So we're going to have a little look at, before I talk about the ways to connect to GPs, we're going to have a little look at the cultural shift of the NHS and why it's happening. We're going to have a little look at the NHS's long-term plan and how acupuncturists can create and integrate with this plan. And you're going to learn ways to build links with GPs and other allied health professionals, and discover and think about ways that you can connect to your local CCGs. We're going to look at resources that you might then use to connect to the NHS, and how this will benefit you and your individual practices if you take at least one action away from today and you do that, then you will reap the rewards in your own practices too. So just before we go through, can I just see if we have any NHS staff here at all? Yes. I was kind of hoping that we may have some doctors or any NHS staff at all. What do you do, if I may ask you?
Emergency nurse, working in accident emergencies.
Great, welcome. I'm glad you're here. Do we have any others? No GPs?
I'm not. I work in 2 GPs practices, and I've set up a unit in a hospital for maternity acupuncture. But none of those are actually employed by the NHS. But
Yeah.
I've got a lot of experience trying to run alongside.
Great. That's really great to have you here. So feel free to come in on my talk, my presentation today, if there's anything valuable that you may add that we can share together. Thank you very much. So my journey started when Clive Lewis, a local MP, Norfolk MP for Labour, came to treat, and he came with the Federation of Small Businesses, and together in my clinic we set up a circle of patients, practitioners, Clive and the Federation of Small Businesses, and we did a question and answer session. And Clive, our local MP, our questions were, how can we connect locally to the NHS and to GPs? So Clive has promised to connect us to our CCG, and I'm currently at the moment liaising with them how that's going to happen, and they've set me up as a kind of case file, and that will be happening later on. Hopefully, they said 21 days to reply, and that's just gone over, so I'm hoping for the reply soon is when we can actually make that date happen. So that is happening. So I would encourage you also to contact your local MPs in your area and try and make some connections there. Because literally, I think the question I asked when we opened the case file was, can you help me connect to the local CCG? And they said, yes, no problem, Rebecca. That's not a problem at all. And I think that just helps us, give us that foot in the door. It's quite, they're quite large organisations, aren't they? And quite frightening to us acupuncturists sometimes, all the big medical professions. So I think a big name like Clive Lewis connecting us. Sorry.
What is a clinical commissioning group? I don't really know what they do.
Yeah, so they provide the funding for local. They decide the budget really for local NHS GP surgeries, what they're going to spend it on. Yeah, so they're quite important. So let's have a look at, we'll come back to that later about the GPs, how to connect to them. Let's have a look at the NHS and what's happening with the NHS, because I believe after all the research I've done, it's changing, and this is quite exciting for us as acupuncturists. So the NHS new model that's coming in is very different from the last model, and it actually aligns with our values and our way of holistic working much more than has previously been happening. They've realised that they can save money by more holistic preventative healthcare. And of course we've been doing that, haven't we? You've all been doing that in your clinics. So they're now aligning a little bit. It's coming in. It's going to take a while for it all to be integrated, but it's quite exciting, I believe. So this new patient-centred approach is going to be, from the NHS, is empowering individuals to take control of their own health. That's what we do. Involving individuals in decisions about their health plan. No decisions about me without me is their slogan. They're going to be working with local communities and organisations to provide services for health and well-being. That's us. There's going to be changes in the way the funding happens, and I think that gives us more scope as well, which I'll talk about a bit later. And the NHS will be implementing a preventative services programme. So like I said, they're looking at more preventative medicine so that they're basically trying to cut their costs, and then the GPs can concentrate on the biggies like heart attacks, diabetes, cancer, by saving the GP's time. That's what it's all about, cutting costs and saving the GP's time with this new model. Yeah.
Where's that from? Because I'm in the surgery as well.
This is, so I've taken this all from the NHS website, and this is their long-term plan, which I'll tell you about in a second. So the growing demand for health empowerment from both patients and clinicians and commissioners as well are beginning to give patients the choice and control over some of their decision making. Not all patients, some patients, when we'll look at the categories in a little bit further. And the clinicians and the commissioners will be tapping, and in some cases this is already happening, tapping into new resources as well. So let's look at the NHS long-term plan. As medicine advances, health needs change and society develops, the NHS has to continually move forward so that in 10 years' time we have a service fit for future. The NHS long-term plan is drawn up by frontline staff, patient groups and national experts. It is an ambitious, but it's realistic. So the long-term plan covers every aspect of running the NHS, from budgeting to employing staff to planning. And I've picked out just a couple of points within that long-term plan where I feel that us as acupuncturists may be able to connect more. It's very big, it's a very large document when I printed it out, but I've gone through it and I think there's two areas or possibly three that we can really connect to moving forward. I'd like to show you a little video on the integrated personal commissioning, and this is taken from the NHS website. Oh.
Integrated Personal Commissioning, or IPC, is an innovative practical delivery model that enables the NHS and local authorities to join up their approach by providing health and social care services around the individual. It is a new model which can be implemented locally using existing powers and duties, and it's a key bridge towards securing the future sustainability of the NHS. It ensures that people are seen as experts in their own condition and partners in their care, rather than passive recipients of services. Better joint working across health and social care is vital to improving health outcomes, both for individuals and the system, but our attempts have often failed to recognise the pivotal role that people themselves play in integrating their own care.
IPC helps people to find new and better ways to meet their health and wellbeing needs and make less use of formal health and social care services. This works by enabling people to make more use of their own strengths and abilities and what's available in the local community. For example, in the case of loneliness, which affects a lot of older people living in the community, the answer often lies by really connecting people up to other people with lived experience or other people in their community, rather than traditional support.
IPC is the backbone for providing this more personalised approach and sets out in practical steps how the NHS and local authorities can join up health, social care and education at the level of the person through a single person-centred plan which focuses on what matters to that individual.
So who benefits from this approach?
The IPC programme is of particular benefit to disabled people and those with long-term conditions and complex needs. Currently, these groups make up about 30% of the population and account for 50% of all GP appointments and occupy 70% of hospital beds. The benefits are increasingly recognised that this approach can bring to the system and to individuals.
So how do we make this happen? Well, the IPC delivery model sets out practical steps that commissioners and providers can use to join up health, social care and education. It provides a whole system approach to personalisation and delivering personalised care at scale. So what's changing?
For IPC to be really effective, there needs to be 5 key changes in place.
The first change is proactive coordination of care. So the IPC model helps to identify the people who have a lot of contact with the system and looks at what's working and not working from their perspective and from the perspective of the local system. So it enables you to target people who will benefit most from this approach.
In life, we don't make that easy distinction between what's social care and what's healthcare. I know certainly for me, as my health condition has progressed and deteriorated, I've still got all social care stuff as well.
The second change is community capacity and peer support. So IPC really focuses on people's strengths and how to get support from peers in the local community. So it's about really finding out what matters to people, and through community navigation and social prescribing, making full use of the assets in the community and support from other people.
Having mental health challenges, often you can feel that you don't really want to kind of talk about that because it's still a taboo in society. But going to a peer support group where everyone's had mental health challenges, you feel really free.
The third change is person-centred care and support planning. This is a better conversation, a conversation about what matters to you as well as what's important for your health and well-being. It builds on people's skills, confidence and aspirations so they can take more control over their plan. It provides a one-plan approach, so it brings the whole multidisciplinary team around the individual.
My own package is joint funded, so I'm 60% funded by social and 40% funded by health. So it took both agencies coming together to work out how best to manage my care, to fit it around me and what mattered to me.
The fourth change is choice and control. So some people would be eligible for a personal health budget, and it's looking at how we can be really flexible with the resources that are already available in the system. IPC is also helping drive the uptake of personal health budgets, with now over 23,000 people holding a personal health budget, with many living in areas that are currently engaged in the IPC programme.
What I love about IPC, it puts the person in the driving seat of their care. So they're the ones who decide how they want to live their lives, what risks they want to take.
And the fifth change is personalised commissioning and payment, so more choice of support.
I believe that through partnership work in IPC and personal health budgets will make a real difference to people's lives, and think about contracting in a different way.
These changes will only work if they're designed and developed with people with lived experience, so disabled people and people with complex needs and their families. So it's really important that they're involved right from the beginning.
And these changes need to be championed at a senior level across the system. It needs system leadership. Good attention needs to be paid to the workforce development so that you're changing both the culture and redesigning the workforce to be able to deliver personalised care.
So in summary, integrated personal commissioning is a practical delivery model for commissioners and providers that enables the NHS and the local authorities to join up and personalise their approach.
IPC improves people's health and wellbeing outcomes by giving them more choice and control. It can also reduce crisis in people's lives that lead to unplanned hospital admissions or admissions into institutionalised care. It can also deliver improved value for health and care system by improving quality, integrating care and supporting inappropriate demands and costs.
I hold a personal health budget for my son. At the moment he's stable with his seizures. He's not been to hospital for 12 months. He hasn't had an infection for a long time. He's alert, he's happy.
We have plenty of resources and guides about IPC on our website, so please do take a look and sign up to our learning network to receive our latest updates.
Let's have a little look at the group of patients that may benefit from this new approach. And this is where I think we come in, because I think some of our patients, or certainly in my clinic, we're seeing these patients where the NHS is trying to save money. That's the biggie. Remember that. Save the NHS money. That's a golden message. If you can help them save money, you're on to a winner. So the people that this new system within the NHS, their long-term plan, are aimed at and helping to cut the costs and to save the GP time, is children and young people with complex needs, including those eligible for education and healthcare plans, people with multiple long-term conditions. Have we got those in our clinics? Yeah.
So that could be things like fibromyalgia, mental health,
Yeah.
fatigue,
Yeah.
ADHD.
Any other ideas? What about chronic musculoskeletal conditions? The elderly, the lonely and the elderly, OA of the knee. People with learning disabilities and high support needs. People with significant mental health needs, such as, and I was looking at this in more detail, and the mental health, it actually stipulates mild. It starts from mild mental health and then increases. So I have a lot of patients coming in with mild mental health in my clinic. Do you do too? Yeah, lots of nods there. And those are the client areas that if you're going to go for a piece of research, which will really be good to connect, which we'll talk about in a moment, then these are the areas where you really want to be looking at as well. When I first qualified, back 9 years now I've been qualified, I worked in another multi-bed clinic in Norwich called the Pain Relief Clinic. And we sent out an advert in the paper. It was a multi-bed disciplinary clinic. And we sent out an advert in the paper, and we ended up with the doors opened on the day. We didn't have any bookings, and all these floods of over 65 patients came in with pain conditions. And they came and they came and they came, and I think by the end of the day we seen 30 patients with me and another acupuncturist. So then we were like, right, we need to get more acupuncturists in to cope with this demand. And then for the next couple of years we continued to give pain relief to the elderly. That was how I first started getting involved in multi-bed acupuncture, and it was really lovely because we sat the patients in circles and we treated lots of knees, and they all chatted to one another, and they then brought in their photos of what they used to do years gone by. They then bought us cakes. They were like, oh, it's Elsa's birthday. Can we bring a cake in and celebrate Elsa's birthday? And we were like, yeah. So we did lots of birthday celebrations, and we had an elderly couple they were over 80, and they were both single, and they actually hooked up together, yeah, and they became a couple, and we weren't expecting that. And that continued. We ran that clinic together for about 3 years, and then I went on to open my own multi-bed clinic. But I think that was a definite success of treating that age group of long-term conditions. And they were really open to it as well. They couldn't wait for the next acupuncture appointment. And I think it really helped them also bring them out of their homes as well, because a lot of them were lonely. So it served two purposes: bring them out from isolation and also treat their pain. So I think that's if any of you are thinking of starting your own multi-bed, I think that's a very good model. And I tell you, it was just lovely to work in as well. They're so sweet, you know. They brought me in like courgettes from their allotment and things like that. It was such a special time. And don't forget, long-term health conditions and the disabled patients and all the categories we've just looked at make up 50% of all GP appointments. It's large, isn't it? 50%. So if we can tap into that market, particularly with the elderly, that's using a lot of the GP's time, and are the painkillers helping them if they're going back and back and back? And pain, well, you know the research in pain. Recently, we've heard about a lot of pain research in last year, particularly in America, and it's really putting us on the map to do something amazing now for pain relief. So I think that's quite a good model that connects with all the different areas that you kind of need to connect to if you're wanting to do something big, which we'll talk about later.
Who funds it?
Well, we're going to be talking about the funding later, so if I may, I'll come back to that. Yeah. So part of the long-term NHS plan is something called social prescribing. And this gets me really excited, because social prescribing is different to medical prescribing. Medication, medical prescribing. Social, well, it's all the people that go to their GP that either don't want medication, or they're isolated and lonely. They've got other problems that the GP can't really help with. Yeah, there's a list. Do you want me to read through the list? I'll read through it quickly, just for your purpose. Aims to support the people with a wide range of social, emotional and practical needs. Save the NHS money, don't forget. Go away with that firmly in your heads. That's a really important point, particularly in primary care. The focus of many themes is on mental health and physical well-being. And there's going to be or there already is in some areas, this social prescribing is happening in areas already. There's going to be face-to-face contact with a link worker. So a link worker is employed by the NHS. There's 500 of them already at the moment. And there's last time I looked, and there's a plan to get this into every single GP surgery. So the GP surgery employs the link worker, and the link worker meets the patient face to face and discusses their problems and concerns, and then gives them a list of agencies, charities, organisations, and together with the link worker and the patient, don't forget, is the patient-centred approach. So the patient has a lot of, focus themselves and can say what their own individual aims are to the link worker. The link worker listens and then connects them to the appropriate agencies or organisations or businesses that may help. And treat is on the list. I managed to get us on the social prescribing list. It took a bit of, I wrote an email and I received an email back, and he said, I'm not really sure what you're talking about, Rebecca. We certainly aren't allowed to refer, the GPs are not allowed to refer to anyone complementary health or acupuncturists, and GPs only follow the NICE guidelines. So then I sent him all the research that I've been doing and went back and I said, but I don't really understand why you're saying no, because I found all this out. And then he came back to me and went, thank you very much for your email, Rebecca. We're going to put you on the list of social prescribers in Norwich. So I will check that out and make sure we are firmly on the list.
Where does the list go? Sorry.
So the list is going to be with the link worker, and then the link workers, so we've got the list of organisations, and then the link workers connect with the patient and go through the list. So it's kind of, the patient makes the decisions. So what the link workers can't do is be suggestible. I think you need acupuncture for your knee. But if the patient looks at the listings like, oh, acupuncture, I've been thinking about that, I've heard it's really good, then there's that connection there that can be made.
Is the link worker, does the link mean the link between medical and social?
Yes, basically, yeah. And they're not medically trained, but they are employed by the NHS. And we're looking at getting more and more of them in the UK.
Are they social workers then?
No, but they can be. So they're not actually social workers, but a social worker could apply, I believe, for a position of link working.
I know you said that it's different in different areas.
Yeah.
And obviously it works this way in Norwich. How does it work in other places? Is it
Exactly the same. Yeah, exactly the same. It's a fairly new system. So the NHS 5-year forward planning finishes in 2023, I think, or 24, remembering from my reading. So it's not been that long, really. We're right at the beginning of it. The pilots have just finished in a lot of areas, and the link workers are not yet available in all areas yet.
But they should be in time.
They should be, and I'm going to tell you about the man who's behind it next.
So sorry for asking.
No, you're fine.
So absolutely wonderful, but where do I start? I'm listening to all this is wonderful, so I go home and I'm thinking, okay, so
where do you go?
Where do I go? Where do I find the link workers?
Yeah.
Or the patient comes in and I say, do you have a link worker? Because we could do wonderful things for you. So
Yeah.
what do I do?
So what do you do as an acupuncturist? Is that what you're asking me? You're not a GP.
No, I'm
Yeah.
an acupuncturist.
Yeah.
But how do I make this connection that you already made?
Well, I think as we go through that,
I wrote the email.
yeah.
How do I write the email
I-
when I go home?
I go on to that a little bit further. Yeah, so that's okay, but we'll cover it, and I'll come back to you and make sure by the end of it we've answered that. The social prescribing often uses services provided by the voluntary and community sector, and it's mainly qualitative research. Qualitative, the views of the patients, their opinions, rather than quantitative conclusions and data. So they're beginning to listen to what people are actually saying as well, which I think is a major change for the NHS as well. Yeah, I've covered all that. So let's go on to the next one. I'll tell you who's behind social prescribing. So Dr. Michael Dixon, he's the lead in social prescribing. Has any of you heard of him? No. Yeah, got a few nods, but mainly no's, actually. Dr. Dixon is a strong advocate of preventative medicine. He is a GP, and let me just get the details. I have to just, whoops, sorry, smash the equipment. Let's get rid of that. So he was the chair of the NHS Alliance from 1998 to 2015. He's the past president of the NHS Clinical Commissioners, and he now chairs the College of Integrated Medicine, integrated between, integrated complementary health, basically, and medicine. And he is a very strong advocate of complementary medicine, and he is the lead of social prescribing. So I think really with him being the lead, his aim is to make social prescribing in every single GP surgery. And he says the answer to over-medicalisation and souring health costs, it's his ambition that social prescribing is given to every single patient in every single area. So I think as time goes on, there will be more opportunities for you to link to with the link workers particularly, which we'll go through later. Has any of you heard of the personal health budget? I'll be interested to know if any of your patients have come in. Yes, we've got hands going up. Have you had patients coming in? Or?
I went to an event at the John Innes, which you know,
yeah.
To introduce people to other people wanting the personal health budgets, wanting to spend their budgets, and I did actually pay for a stand. Oh. Unfortunately, you put the stand on the first floor. Almost none of the people could get up the stairs.
Oh, how shame!
And what was on the bottom floor was a lot of companies. So it was kind of like, if you're going to be able to do this, to penetrate personal budgets, health budgets, it's like you're going to find opposition from other people who want this money, companies.
Yes, definitely.
And I certainly felt we've been, there were just a few of us on this first floor, have been squeezed out.
Yeah.
Yeah.
Oh, what a shame.
Sorry, that was my experience.
Yeah, that's great that you were able to be in there and have a stand at an event.
So I
that's
felt
great.
That at least the organisers had seen me.
Yeah.
One or two people.
And how did you get to be there in the first place?
Because I think there was a consultation about the future of the NHS and complementaries in the Norfolk area.
Yeah.
And so they invited me to this. I also went to a big meeting where I brought up a couple of things where the NHS might spend money on acupuncture for particular issues. And actually, I'm sorry to be so negative, but the speaker, one of the speakers, who was a doctor, at the time there was some negative stuff about acupuncture from a study in the States, and he managed to quote that to me, and I felt soundly rebuffed actually. But the person sitting next to me was a person who was one of the involved, you know, in the organisation at probably a high level, and he said, and he patted my knee and he said, "Don't worry," he said, "it'll come." So I'm hoping you're the person who make it come.
Let's do it together. Let's put those pebbles out and make those ripples and do it together. There were some other hands. Thank you for that, Dick. There were some other hands that went up. You've heard of, what I'd be interested to know is any of your patients have used the personal health budget already to come to acupuncture? Has any of you? Am I the only one? Am I? I'm surprised because I've also got a patient who does Reiki, and only last week she said to me, oh, we were talking about the NHS and I said I was coming here. We were chatting away and she said, well, one of my patients who has a chronic condition has used the personal health budget to pay for Reiki. She's had 5 sessions. Yeah. So this is part of the long-term health plan.
Do people who have illnesses know there's a personal health budget? Because I don't think they do.
No, this is it.
That's the problem. So I had a chap who asked,
yeah.
he had chronic pain. He was seeing me every week. The NHS had no idea. He had some surgery, and after surgery he had chronic pain. Nobody knew why it was happening. They couldn't find a solution on huge doses of opiates and really ill. And he had 1 treatment of acupuncture a week with me, and it really, really helped him. He asked if they pay for 1 extra treatment a week because he said he felt he needed 2, but they wouldn't do it.
I think it's a bit like me going to the link worker and them saying no, and then I went back. So I think educate your patients to persevere in this area.
I wrote letters and everything for him, but he said I just need 1 more treatment a week paid for.
Is it available in your area, do you know? Because that might be something you can check.
I don't think so.
It might be worth...
Our area's pretty bad.
It might be worth going to your local clinical...
Our NHS is one of the lowest, sort of success rates in the country.
Bless you. Yeah, I mean, it's really down to the GP to be recommending it, but now you know this, you can tell all your patients to go and see if they can get it.
Can somebody please pay for 1 treatment rather than have all these medications which are not helping me? That's what I really, really need. 1 extra treatment of acupuncture.
Oh, bless him. That's such a shame, isn't it? Don't give up. Keep trying. Keep trying. And there is, it is circulating out, and it's going to become much more well known. This is very new.
So I came to acupuncture because I've fibromyalgia. I'm also a member of my local fibromyalgia group. We have some of the patients, some of the members of the fibromyalgia group that come to the clinic as volunteer. But the only thing that we are told by our local area in Loughborough and Leicestershire is that you can get access to gym membership and leisure.
Yes,
and
yes.
There is no mention of any of these alternative other things, apart from maybe, I think you can get so many sessions with like swimming clubs for weight loss.
It might be worth you checking, if you're interested, to go to your local CCGs and to find out exactly what's happening, and then when you get the answer of your local clinical commissioning groups, that's the people that provide the budgets and say where the money goes, and find out what's actually happening there, and then you can advise your patients that way.
As an ex-counsellor, can I just say, I was a counsellor for 20 years, and can I just say there are actually local counsellors on the CCGs.
Yeah.
And that might be a way to actually get to the CCG.
Yeah, that's another idea. Thank you.
I think that I know in my area, because we've got Nicky Morgan in London, which everyone's probably heard of, is our local one. And she's a big advocate for sort of mental health, but not so much other things. So we actually have a health and wellbeing sort of cafe next door that she gets involved in heavily, which we've actually done some liaison with mental health, but not with the other sort of side. So I think sometimes they get stuck in the...
Yes. Well, this is it, yeah. We need to unstick them, don't we? move their blood and their stagnation as well. That's another idea that we've got. Taster days for GPs, but I'll come on to that in a bit. So these lists are examples. They're not definitive lists that you can access in every single area, because unfortunately it does depend on your local CCG and where they're putting their money into. But do check it out and see what's available. And it's quite nice to see massage and acupuncture is up there, and specifically acupuncture for pain relief. I think that's an area that, you know, it ticks all the boxes. If you're going to go down an avenue, that's one to definitely follow. So you can see that there are a few emerging opportunities there with the NHS and the long-term plan. So we're going to have a little look. Before we have a look at how and the ways that you're actually going to connect with possibilities of connecting with your local GPs and allied professionals, this is a very important part of what we do. The British Acupuncture Council has amazingly connected us to the Professional Standards Authority. It's not cheap for the British Acupuncture to become a member. I had a look at the figures. And this really does give us credibility. So I was chatting to a lady at dinner yesterday, another acupuncturist, and despite the fact that she's a British Acupuncture Council member, she was unsure of what the Professional Standards Authority even did. So I thought, right, I'll make it my mission today to clear this up, because GPs can refer to us, not through the NHS, but they can refer to us because we are now members of the Professional Standards Authority. So they can actually say, I've heard of a very good acupuncturist in Norfolk. I've heard from my other patients, perhaps, you know, that Dick Lamb is very good at treating chronic lower back pain. I've checked him out. He's a member of the British Acupuncture Council, and they are on the Professional Standards Authority. So therefore, the GP is competent that they can point the patient in the direction of the acupuncturist. So I'll just show you a little video so you all know the importance and the wonderful job actually as well that the British Acupuncture Council has done connecting us to this.
Everyone uses health and care professionals at some point in their life. We see our doctors, nurses and physiotherapists at our local health centres. When you need your eyes tested, you'll visit your local optician. Or you might pop into your pharmacist to ask for advice or collect a prescription. You may need a dentist, chiropodist or osteopath for an ailment. There are over 1 million health and social care professionals in the UK. By law, many of these professionals must be on a register, each with a statutory regulator. It's the job of the Professional Standards Authority to oversee these 9 UK regulators to help ensure your safety. Our monitoring and scrutiny of the regulators is important to protect you and other users of health and social care services. If you are looking for a health or social care professional or have an issue to raise, you can contact the relevant regulator. Whilst the Professional Standards Authority is not a complaints handling organisation, we do welcome feedback on the regulators and we take this into account when reviewing them. We conduct formal reviews of each of the 9 UK health and social care regulators. And we review the regulators' performance every year and tell Parliament how well they are protecting the public. In addition, we set rigorous standards for organisations holding registers of health and social care workers who do not have to be registered by law, but may choose to register to show their commitment to good care. We only accredit those organisations that meet our standards. We share knowledge and good practice, conduct research and introduce new ideas to our sector. We monitor policy developments in the UK and internationally and provide advice on issues relating to professional standards in health and social care. the Professional Standards Authority. Improving your safety is at the heart of everything we do.
I don't know about you guys, but I feel quite proud to be on their list as an acupuncturist. Hang on then. Let's start that again, sorry. There we go. So GPs are assured of the competence, which is the main thing there. This little paragraph was taken from the PSA website. Just give you a minute to read that. So when you're in your communications with your GPs, don't forget to put the logo on. That's really important. It's on the British Acupuncture Council website. And there is a little bit of criteria that comes up that you need to read as you download the logo. And the things it says is that you need to know that the voluntary register scheme was set up by the government to improve standards and safety for the public. It's an accreditation which demonstrates our commitment to high professional standards of enhancing safety and delivering a better service. And don't forget to put the logo in every single method of communication you do. Even an email, pop it on your email signature as well, your website, and any documents that you give the GPs as well. So this is the meaty bit, what you've been waiting for. So let's connect, build relationships, and educate GPs and other allied health professionals in our local areas so that they can send patients your way. I'm not necessarily saying, at all that we should be employed by the NHS, but I think if we send the message out and try really hard to connect to our local GPs, then, eventually with willpower, keep on and on and on. It's not easy. I'm not saying it's easy. You've got to do the groundwork, but if you really want this to happen, it can happen. And in Treat, we're building really good connections already with our GPs, and we are getting GPs that are referring patients to us already for knees, for pain mainly. I've had a GP referring a patient to me the other day for neuralgia. I've had one for chronic lower back pain and osteoarthritis of the knee, and that's just in the last month. So keep doing it, send those ripples, and you never know what might happen. So let's go through the list. Have you heard of patient participation groups? Has anyone heard of that? So I'm now attached to my local participation group in my local GP surgery, and we meet about 4 times a year, and we're meeting to talk about my local GP surgery, but at the same time as I'm there, I'm getting my foot in the door and I'm saying, how about putting on a taster treatment day here for complementary medicines? And I'm in discussion with them at the moment to make that happen at my local GP surgery. It doesn't cost you anything to join. The NHS, every single practice has to do this, so they've all got these groups. So get your name on the list. It's not much work at all. They want your input a little bit about their own practice, but that gives you the opportunity then to meet some of the doctors, have conversations about acupuncture.
So is that the group that you're a patient of, or where
Yes, I'm a patient of, yeah. Yeah, so you want to be connecting to the ones where you live. Yeah. No, that's the only thing, unless you've got other practitioners, but maybe not in your case because you work from home, don't you? 3 different places. Busy lady. Ask your patients to tell their GPs how good you are. How many of you do this? This is really simple. This doesn't make much effort. How many of you do this? 3.5. 3.5 of you do this. this way, you can do this while you're chatting to your patients. You can give them your leaflet and say, you know how well we've done for your lower back pain? Would you mind telling your GP and just giving him my leaflet next time you go in? They're your advocates. They're really happy, aren't they, to say how well you've helped them, because a lot of the patients that we see don't want to be on medication, do they? So they're wanting it on the NHS. So if you encourage your patients to tell them how good you are and what a difference you've made to their ailment specifically. I spoke to a GP about this, and she said to me, this is one of my patients, and I was talking about complementary medicine, and I said, do you decide at all, because she was telling me she refers a little bit out, and I said, how do you decide who to refer to? And she said to me, I listen to what my patients tell me and where they've been for a good massage, good acupuncture, good reflexologist, and I make a little list, and then she tells her other patients. So that's a very, brilliant GP who's connecting all the dots. I know that there's a lot of groundwork to do, but if you tell every single patient that you see, and some of them tell their GPs, you never know where these ripples may go, and you may make waves. What's next on the list? So we've got taster treatment days at your clinics. So you could put on a taster treatment day. If you haven't got a clinic where you could do it, join forces with another acupuncturist or two or three in your local areas, and put on a taster treatment day, and then invite your local GPs to the taster treatment day. You could call it something like taster treatment day or acupuncture for GP ailments or something like that. And then invite your GPs to come out and see how many you get. It's worth a go, isn't it? Anyone done anything like that? Has anyone done a treatment taste day?
We used to be based at GPs, and so we put on within the surgery, there's 16 GPs in that surgery. We put myself and osteopath and physio put on an hour and a half presentation, and some GPs came. That's about 11, 12 years ago. And did any of them then refer you patients after? I think some did and
some didn't, and some, I mean, there's always going to be the...
few, but it was a few years ago now.
Yeah, worth trying again then. But great, well done for getting your foot in the door and putting on a day
now,
and connecting to them. That's great. Write to your GP. So on the British Acupuncture Council website, you can write to your GP, and there's letters on there that you can use. And the areas that we're reminded of, I want to remind you of the areas you can write to them. Refer for red flags, that's very important. Serious disease, discuss changes in treatment, and acknowledge referrals. Write to every single GP that does refer you a patient and say thank you. I was in Emma Cannon's talk yesterday, and she was talking about, a few nods, she was talking about writing to consultants, because she works with the IVF clinics and the consultants there. And she said she's been writing to them for a good few letters, not much came back, and then she said she started to get them, didn't she? And now she's got a really good relationship with them. So that's really positive. And I was also talking to Alex Humphreys, and he's a member of the British Acupuncture Council, connected to the Northern College of Acupuncture, and he's training GPs at a student level. And I said to him, is it well received? And he said, well, when they first come in, they're quite sceptical. And he said, but he manages to win them over, and then by the end of it, they're really interested in what he's saying. So I think if we try, we never know where it might lead, and the right GP who's interested might then refer. I think the lady at the back, did you have something to say?
So I do sort of talks to the GPs, clinical meetings every year, and I find the only way of sort of getting them past that kind of frostiness and getting them on board a bit more is to say that I'm happy to extend a taster session to anybody who works in the practice. And so there's about 30 people, if you count all the comings and goings and care workers and midwives, and so actually that widens the net quite well. And once they've experienced it, they've met me and they know that I haven't got a broomstick in the corner and that I'm kind of, half normal, then that, I find that's a really good way of percolating trust.
Yes.
Once they see my face, they're much more likely to say to a patient, I'm not supposed to say this, but we've got an acupuncturist here, or they actually need to say it without saying that now. So.
Are you working in their premises as well, did you say? Yeah, which is also on my list. Yeah. Rent a room in a GP surgery. That's brilliant. Well done, you.
Having an experience that I find is, for me, is the best way.
It's talking to them, really. Yeah. Educating them, building relationships. We just need to get out there and chat. Brilliant. And I was thinking about even renting a room in a GP surgery. Even if you've got your own practice, you could just maybe rent half a day or 1 day a week and get into there like that. Thank you for sharing that with us.
You have to break the barriers there. I've worked there for quite a while, and that's why I'm here, because it's sort of like reached a level and then you have to sort of keep yourself going.
Yes.
To do with yearly meetings and certainly the taster sessions.
Yeah, I do. There's plenty of people who sit there with their arms folded still, even though if you've been working there for years and years.
Yeah.
You have to completely blank them out.
Yeah. It's going to take time, isn't it? Rome wasn't built in a day, but I think collaboratively, if we all do our little bit together, we can start to really break down those boundaries and make a difference.
Sorry, just to one of your first slides was that there is a change now.
Yeah.
It's softening.
It's the time feels right, doesn't it? That cultural shift is changing, and it's right for us to get on there quick.
I do a placement on a cancer unit in Harrogate, and my last 2 sessions within that are staff in the main hospital, so managers are now referring the staff for stress and anxiety.
Brilliant. Wow, that's fantastic. So quite a lot of you are already doing your little things as well.
I had GP send the same GP send 2 patients for anxiety. I was quite surprised, but I did acknowledge it and I wrote back.
Well done.
And also, a GP sent somebody for a breach, a baby was breached.
Wow.
But she sent...
What, for Moxa?
Yeah, but she sent her because when she was having a baby, she had breech baby, had Moxa for that, and not because she was GP, but just as a mum, she sort of said, but she's GP as well.
Yeah.
So I had that when I had my baby.
Yeah, great.
So that was why she came. I was quite surprised with that as well. But
Yeah.
I quite a letter back. Yeah.
Well done for writing a letter.
It's been a punitive result as well.
Yeah, fantastic. Don't forget the midwives as well for things like that. I have midwives referring my patients to me for Moxa too. So if you can link in, I go to a regular meeting with the midwives at the hospital as well. I don't really know how that happened, but I just suddenly in my inbox one day I had an email inviting me to go with other professionals. So I'm in with talking with the other professionals at this meeting. So any areas you can get into, just try, and you never know what happens. That's brilliant. Where did we get to? So we've covered. Talk to your existing NHS staff patients that you've already got as well. So I've got a practice manager who comes to see me. So I've been asking her advice. I've got several doctors, I've got several midwives. So I wait for the right opportunity. They don't just come in, I go, oh, by the way, it's usually when they're leaving the clinic. And I just catch them as they're making their appointment. And they're really happy. My patients are really happy to help me to make these interconnections to use that. How many of you have GPs or midwives or physios or radiographers come to your clinics? Yeah, so about 6 or 7 of you. Yeah, that's good. Create a referral pack and hand to the practice managers. So I've got a slide which tells you what is going to go into the referral packs. This is a tricky one. This is where you need to have a bit of time, and you've got to find out who the practice manager is, because they're not always on the website. I'll just flick to the next slide. So you can go onto the NHS website. I found this, and if you click under find a GP in the search, then you can put your postcode in for the location, and it brings up the GP surgery, and then you click on staff, and that gives you the name of the doctors and the name of the practice manager. And then I phone the clinic and I say, hello, could you give me the email, please, of your practice manager? And I've got loads. The reception staff are quite happy to do that. So then I'm going to email the practice managers. This bit I haven't done yet, but this is my plan. I'm going to email the practice managers with my referral pack. And if I don't get a reply, I'm going to turn up on the door and just knock on the door and go in and say, is it possible I could speak to so-and-so? Because I have her name already from my list. A name is good to go in with. And I'll let you know how that goes. I'm going to do all the groundwork. My aim is to go to every single GP surgery in Norwich. So I'm going to see my local area. So I'll let you know. I'll give you feedback maybe next year or through Kevin how that happens. A referral pack. Well, I've got a list. I've got a slide which tells you all about the referral pack. So it's basically information to tell your GP what they need to know in order to refer to you, including a referral form in there as well. So it just looks a bit professional. Put it in a nice document. Don't forget your professional standards logo on there. But we'll cover that in a bit more detail in a moment. Connect to your social prescribers in your area. So just to tap back to your question earlier, to connect to the link workers, I went through Norfolk Community, I've got the name somewhere, Norfolk Community Action, and then they gave me the name of my local link worker. And then I had a little look in all the other areas, and I saw Gloucester Community Action and Suffolk Community Action, etc., etc. And I emailed them. They gave me the name of the link worker for social prescribing. Don't forget, part of the long-term new NHS plan. I then emailed, got the no response, sent him all the research, and then he's put treat on the list. So that's something I think that's worth doing as well. It's not direct with the doctors, but it's liaising still in that same area. And somebody already talked about giving a I think that was you, talked about a presentation that you did at your local GPs. So they have meetings that the GPs themselves regularly have to do for their CPD. So if you can get in there and prevent, just do it small. GPs are very busy, 10-15 minutes. There is PowerPoint slides on the British Acupuncture Council website that tell you what is acupuncture. And there is the fact sheets that Mark Bovey, nice, welcome Mark Bovey as well for joining us, has done on the latest research, and they're all up to date. So you can use some of those for your presentation as well, your 15-minute presentation. And don't be frightened. Don't be frightened. We all poo in the same toilet, don't we? We're all human beings. They're only GPs. Push yourself out there. They do a wonderful job. But yeah, they're not to be frightened. And the last two ideas I've got is go large or go home. This is what I'm working on at the moment. These are the biggies. I might do one and then another one. So for these two, I'm not going to do them both in the same year because my clinic's also very busy too. But one of the ideas I thought, this is more like dropping boulders in and making those ripples rather than pebbles. So here we go. What are they? What are the ideas? Connect to your local CCG and bid for funding for an acupuncture research project. What a fantastic way to connect to your local GPs and really get in there. So I've been emailing Mark in the background, and my plan for my multi-bed in Norwich is to do a knee clinic You know, we were talking about that lovely over 65s clientele that's coming in and tapping into the isolated group of people, which is also on the NHS long-term plan. They kind of want to help the isolated bunch of people too. And we're going to be doing an e-clinic we're going to set up a community sort of non-profit organisation. I'm not going to go for a charity. I've looked into a charity. That's quite long-winded and takes a lot of time and even like 3 months to open up a bank account. So we're going to go for a small cooperative together, a knee clinic for the elderly for osteoarthritis of the knee. And then we're going to, with hopefully some guidance from Mark, I'm going to then, and other people, I've got somebody else helping me in Norwich. And what happens is when you start working in this area and you start emailing out, people pop up from everywhere. And then suddenly all the people you need is all around you. It's funny how that works when you send out emails and things just come back. It's quite amazing, really, how doors have started to open up. So we're going to be doing this, going to the local CCG, and we'll just see what happens. And then I will give you feedback on how that's been. It's going to be a long piece of research, a couple of years, I would envisage. And Clive Lewis, I'm going to go back to Clive Lewis and say, you know that promise you made me, Clive? Can you now, when my research plan and my brief is done, I'm going to then get Clive Lewis to connect me, which I think gives us just a little bit of help. Little me in the middle of Norwich, Clive Lewis, it might help, who knows. So I'm going to give it a go, and then we're going to bid for the funding. And if we don't get it from the CCG, well, I won't stop there. We'll go to other funding places, and the Community Action Norfolk can help me with my funding. And what's really interesting with the social prescribing and the link workers is that they're more likely to put you on their list if you are a charity or a non-profit organisation rather than an organisation. I think I've been quite lucky, but perseverance may get you the same results too. And the other idea, the other go large idea I had, was hold a local integrated health conference for GPs, invite guest speakers. How many wonderful guest speakers have we got already within the British Acupuncture Council? To your regional local event, highlight, I was thinking like, a bit like what we've done at this conference here, really. Have lots of little rooms where you can have your guest speakers come and then send out those invites to all of your GPs. And you now know where to get their names and addresses from. Yeah, just to recap from the NHS website, put in their search, find your GP, go to staff, and you'll get their names, and you've got the address on the website too, and you can write out and send a nice advert with maybe a bit of research and your Professional Standards Authority logo, your own information, and the British Acupuncture Council logo too. I think this is a biggie. This is my plan after I've done the research plan, so one thing at a time, otherwise I get a bit carried away. But I think that's quite a good one. And the Dr. Michael Dixon, who owns the College of Medicine, the integrated approach, the integrated health college has already been doing this. And he's done it on a larger scale. And what it says, the information on his website, is that he had a lot of very interesting doctors turn up. And doctors love being educated, don't they? They've just spent 7 years listening and learning about all their medical science. So I think if it's a big day, I think this will have more of an impact than if you just had a talk at your clinic, for example. I'm not sure a GP maybe. I think you've got to dangle quite a few big juicy carrots to get them along.
They did one of those actually. The NHS Health Organisation in King's Lynn.
Oh, did they?
They invited, for some reason I got invited.
Brilliant.
Yeah, and they had a pretty good speaker actually.
Yeah.
They did have to bribe the GPs to come. They actually paid them.
Did they?
Yes.
They paid them to come.
Paid
Did
the
they?
GPs to come.
Oh,
because of
wow.
that.
Gosh.
Because they also had, other companies.
Yes,
with
that might be interesting.
promotional stuff.
Oh, wow.
But it was an interesting occasion with lots of different NHS staff.
Yes. And were you there at the event?
Yes, I was.
Yeah. And was there lots of GPs that come, and how did they find?
There were about 4 or 5 GPs.
Yeah. And how did they find?
To do with
So you didn't have an acupuncture store there? That's a shame.
No, but I think there was some. I can't remember which complimentary it was, but since I was asked, I thought I would go along.
Yeah, great. Oh, that's brilliant.
But, so the NHS is fundamentally interested in
It is, isn't it?
But
yeah.
Sometimes it doesn't quite go off
the way we plan it. Yeah. No. So I have got a little action plan, but I might just leave it to the end because I think actually, because I've had some wonderful questions and some of you have shared your experiences, I think just for time's sake, I'm going to leave this to the end, but I'd like you to do this for your homework. I'm going to give you homework. So take a photo of the slide, maybe on the train on the way back, or over the next couple of days. If you can take away even just one thing from today that you think you might be interested in doing, and then I'd like you to think about how you're going to implement that action. What are you actually going to do? What are the steps that you're going to do to make your connections? So I'm sorry that we've not had time for it, but please do it. And what I'm going to do is send a piece of paper around, because what I was thinking is if we could help each other, because this is quite a big task we're going to take on, but if we could help each other and support each other to continue to share ideas after today, then that would be really great. So maybe we could have some of your action plans. I was thinking of setting up a little WhatsApp group. Can everybody do WhatsApp? That's really great. Okay, that's what I thought, better than Facebook. And then we can share ideas and you can put your action plans on there. So if you could write your name and your telephone number if you're interested very clearly, and if you would like copies of my slides, pop your email on there too very clearly. And then I can start a little group and we can get those boulders out there, making those big ripples. You've got a pen. So we'll miss that. So you don't need that. That was for there. So I just want to, there's a few more slides. So talking about research, I've been looking at, so if you're going to do the research project, these are some of the things that I think is important. They're like building blocks. The initial building blocks to help you think and focus on your ideas. So it needs to be effective. So Mark, when I contacted Mark about my idea for OA of the knee, and Mark said, well, there's been a piece of research that has already been shown, and it's actually already shown to be effective for OA of the knee. And you can use this idea too. It's particularly good for multi-bed acupuncture. But feel free to do this in your own area too. And the research showed that after 2 years of some of the patients having acupuncture, they didn't need knee surgery, which brings me to another important point of cost-effective and saving the NHS money. Remember, that's what we said earlier. I said those really important points. We need to save them the money if you're going to do a piece of research. Find some research that can do that. That also ticks that category of people we looked at that's going to benefit from the new NHS plan. And then you're kind of building all the right things as starting blocks.
So why would you want to do something that the research is already showing is effective?
Well,
why would anyone want to pay for it?
Well, because I'm going to elaborate on what's already happened and do like the next stage of it. So I'm only in the briefing stage at the moment and putting my plans together. But I know it's effective. So my purpose is really making connections with the local GPs and the NHS and the other allied staff. And this is one way I think I can do this, by doing a piece of research and being taken seriously by my local CCG as well. So I suppose it will be great for acupuncture as a whole if you all did your individual pieces of research as well. But my main aim is building those connections, and we want to already do something that's effective. And I think that's the way research works, doesn't it, Mark? Is that you find something that's good and then improve on it?
Yeah, because they did that in St Albans, and it was nurses who did the acupuncture. So there's some differences there in what you might do. And you're right. It's not something that like the NHS thinks, oh yeah, that's entirely cracked. Then we'll have acupuncture and all that in the osteoarthritis. Obviously they don't. So I think it is something that you need to repeat and you need to kind of hammer home and do in your own locality.
Mm-hmm. Yeah, thank you. Yeah, match your ideas. We've already talked about that. So go back to looking at, you need to be really looking in your own, go onto your local clinical commissionings group and see where their aims are and their targets of budgeting is, and what they're trying to work on, what health concerns they're trying to work on in your own local areas. And then if you can match your own piece of research with what your CCG is doing, and then go to your CCG, you're more likely, I think, to get the funding. But I can certainly show you, or we can talk on WhatsApp about how it's going for me, and I can lead the way for you, so to speak. Could be implemented by the NHS as well. Look at something that actually could be then implemented in the NHS. So it has to be easy. A multi-bed style is quite good, because that's saving the NHS money. They can do it all in one room. You've got to think about logistics as well when you're planning this. And think about where you're going to do it, who with. Collaborate with your local acupuncturist. Don't do it on your own. It's a big thing if you're wanting to do this on your own. So I would say collaborate with your local acupuncturist, network with your local community, and work on it together. I'm going to set up a cooperative, I think, to start with, and then we'll see where we go. But I've already got the acupuncturist in my clinic. We've got 4, and hopefully maybe some of the other Norfolk acupuncturists will come on board too.
So my question is, obviously you talked about the CCG and finding out whether or not you can get funding for sort of people through like the healthcare system.
Yeah.
Sort of 70 sessions or whatever. Could you maybe get groups that are local that have, like for example, I'm a member of the fibro group, to put pressure on them?
Yeah, why not? You could try, yeah. Yeah, in what way do you mean, to put pressure on the local CCG?
Yeah.
Well, I suppose as part of your research, could you, so if you're doing, yeah.
Why haven't we got this? Why is it being offered in some areas and not in this area?
So if your plan to do a piece of research is on fibromyalgia, for example, you could maybe start off by interviewing that client base and then putting that into your research, so that client base has their voice within your research as well. Okay, let's see what else we've got. This is Therapy Aid. This is in Norwich. I just wanted to show you this slide because this is a lady who's already set up her own piece of research, and she's Jackie Hamilton. She's got a massage school in Norfolk, and she has already done this idea, and she's getting referrals from GPs and through the link worker and the social prescribing as well. So they're providing massage for carers. So she's already done it. So I'm also collaborating with her in Norfolk, and she's very happy to share, gratefully, thank you to Jackie for that, to share with me how it's working for her and to give me some ideas as well. They've gone for charity status, but they're going big. They're going out in lots of different areas. But yeah, don't forget to connect with your local communities too, because you never know what might happen. So a couple of slides left. Are you all okay? Or you're not falling asleep? No, you're all right. Got one question at the back?
Yeah, I was just going to ask, will you be covering the referral as well?
Yes, that's my second but last slide. Yeah. So the points to communicate. So with any method really of communicating with your GPs, I'll just stand back in case you want to take a photo of that. Don't forget to tell them we are part of the Professional Standards Authority. Use the logo. Our training is at degree level, and our training meets the World Health Organizational standards. I've taken some of this from the BXC website. We undertake 30 hours of continual professional development per year. We are committed to high standards of safety and professionalism and abide by our codes of conduct and safe practice. We have full medical malpractice and public product liability insurance cover. These are all really valid points for a GP to know. We follow a patient-centred and a holistic approach, like the NHS is beginning to do. Yay! And introduce your evidence-based research project if that's one of your action plans that you're going to do. All right, everybody got a copy of that? So here we go, onto the referral pack. So this is what you need if you're going to put together a nice professional looking referral pack. Put it together in a nice cover if you're going to do it. Make it look all presentable to your GPs. And then go to your practice manager and deliver these. I think that's the best way to do that, to go to your individual practice managers. That you're more likely to get in with your practice manager rather than the GP to give it to. And if when I go to every single Norwich surgery, GP surgery in Norwich, the reason why I'm going to have it in a nice pack is because I think they're not likely going to throw it in the bin if it looks nice and it's, you know, nicely presented. And hopefully I'm going to ask them to distribute it to all the GPs in their surgery, and we'll just see what happens. But those are all the things that you need. I don't need to go through them individually. And we can talk, if you're interested, those of you that are interested in doing that, we can talk together about what goes into a referral form. We're basically going to make it easy for the GPs and to give the GPs all the tools they need to know in order to refer it. And I think if I put my feet in GPs' shoes for a moment, and then I think, what would I need to know if I was going to send my patients to an acupuncturist? And it is about acupuncture, isn't it? Make sure you've got the research in there, a little bit of the research, what it's good for. Chronic lower back pain, knees, pain, you know, lots of research on pain. And the fact you could print off some of the facts from the research from the British Acupuncture website and put that in. Yeah.
Can I just point out that, because you referred to the fact sheets earlier, and said that they were wonderfully up to date.
Okay.
That's not entirely true.
Okay.
We're just in the process of updating 33 of them at the moment.
Okay.
So they will get to be very up to date, but the ones at the moment aren't. So if you want anything on a particular subject, then you can talk to me and we can give you the...
Thank you, Mark. And I think you've already given me some things on pain as well. So, yeah, so I'm happy to send that out to you too. And last but not least, what are the benefits to you guys and your individual practices? So I believe, and I've already seen this happen in my clinic, certainly, that connecting with GPs in the NHS and making these connections with other local organisations too gives you credibility, increases your client base, increases your income, adds value to acupuncture research. You will be taken seriously by your local CCGs, your local health professionals as well. And hopefully you will be getting referrals from your local GP surgeries, and we can, sort of see how that's going. Maybe we can, have some kind of interaction in 6 months or a year and see actually from all of you what's been working and share our ideas together. I think that's really important, that we can learn from each other. And increase your local connections, which we said, with other agencies, like I'm on the social prescribing now for Norwich. And make a difference. Make a difference to the people. Make a difference to your patients. Those patients, who really need our treatment. That's what we're really doing here. That's the bottom line. We're aiming to make acupuncture more accessible for everybody, for the benefit of those that really need it. Don't forget that. Shall we have any final questions? Couple of minutes.
I was just thinking of two things really. I mean, setting up a research project could be quite intimidating for people who tend to walk around.
Yeah.
It's going to take time.
Yeah.
And there may be other things you can kind of piggyback onto. I was thinking about Mark's Anxiety UK connection. There's a project that I think we're all invited to get involved in.
Yeah.
Get involved and then write to GPs and say, I'm involved in this.
Yeah. That's a good idea too.
To do the whole setup.
Mm.
And also if you're doing charity work, you're doing volunteering,
Mm-hmm.
that's an opportunity to write and say, some people with that condition that will volunteer from. Not necessarily want to go to a group, they might want to come and see an individual.
Yeah.
Somebody who works with that condition through volunteering.
Yeah, that's great. Yeah, I think any communication can only be a positive thing. Yeah, thank you for that.
And also, working in Wales, and I'm sure it's the same for you.
Yeah, you feel a bit isolated.
We have different healthcare systems as well, so a lot of these, the personal health budgets, I don't think are happening with us at the moment. So
hopefully they will come in. Yeah.
What's going on where in Wales, I can share it.
Yeah, that would be lovely. Thank you. Thank you very much.
Actually, this refers to Rachel because we're writing a report on the scope of acupuncture that's practiced around the world. It's going to be featuring, amongst many other things, cost effectiveness is a really big part of this. And I really would absolutely encourage everybody in this room to use this and to add this to your pack, because it will be made available to members. We're going to have PDF copies as well as hard copies, so please use them. Don't let's keep this wonderful information in our bottom drawers. We really need to get and to share this wonderful work.
I think I forgot to mention the NHS toolkit actually, which was in my notes, which is on the website, on the British Acupuncture Council website too. I think possibly we can update it a little bit. I think there's a few areas that needs to be updated, but maybe I can help you with that too. But it's there's a lot of information that can be used because I've gone through it too. So do have a look at the NHS toolkit. It's quite useful.
It might be good to contact patient groups as well. You mentioned fibromyalgia, and I actually did a trainer diploma at Kickham, and when we were doing that, we had a lot of fibromyalgia patients because they went to a group, and one of the lecturers there had been to the group to talk about it and demonstrate, and they liked it so much that actually they had some funding from somewhere, and they gave each person that came to us discount. They gave them a voucher so they could actually have really affordable treatment.
Wow.
So there are little pockets of money being given to these groups in the community, but you just have to tap into them. Go and talk to your fibro group.
Yeah.
And then you can say to the GP, I've been out and talked to these groups, about how acupuncture can help them.
At the moment, my local area on the NHS still offers 5 sessions, but then once those 5 sessions are gone, you can't have it ever again. So the patient is then left, because obviously with fibro it doesn't go away, it's just about management.
But if you're in a group, contact the Reading Fibro group because they have tapped into some funding.
Okay.
So you might find out where they've got funding from.
Yeah, you can, if you, you know, have a really good idea, there's different pots of money you can go into. It doesn't stop. You get one bit of funding and then you can apply for another and another and another, especially if you're then, you know, proving that what you're doing is successful. I think, you know, one of the things we're going to be doing is mopping our OA of the knee patients when they come in, and then collecting all the evidence. And then if you've got that evidence, you can then present it and get more funding and carry on your projects, which is what Jackie Hamilton has done. She's going into different pots with her care for carers, massage for carers. Okay, well, we've run over, so I'm sorry about that. We better stop. But even if you put a little pebble or a boulder, go for it. Let's work together.